Now, there are many medications that are out there to help ADHD. I'll describe the ones in the US. You have most, though not all of these. Certainly, the stimulants remain drugs of choice for most ADHD adults, though the non-stimulants can also be quite beneficial for subsets of adults with ADHD. The developments, as I explained yesterday, in our field over the last decade have been in delivery systems. We don't have new stimulants. What we have is new ways of keeping these medicines in the bloodstream for hours longer than was originally the case with the immediate release pills that were on the market. So now what do we have available? We have the pump, Concerta, which is a little miniature pump that squeezes out liquid Ritalin for about 8 to 10 hours after you swallow it. How cool is that? That is a neat little osmotic pump. We have the time-release pellet system. This is Adderall XR and Focalin XR and the other time-release forms, the pellet system. These are little time-release pellets, and some dissolve now, some in an hour, some in 2, 3, 4, 5, 6, 8 across the day. By the way, there is a slight difference between the two delivery systems in when they reach their peak. So if you encounter problems more in the morning hours, the pellet system is a little bit better. It's releasing more medication in those earlier hours. If you experience more problems in the afternoon toward the early evening hours, the Concerta pump system seems to be a little better because it's releasing more of its agent late into that afternoon day. But across the day, both are pretty good, and both delivery systems last about 8 to 10 hours. The next development was the skin patch, which I don't believe you have, and this is Daytrana. This is methylphenidate in a patch that you can wear on a hip or a shoulder, and you absorb your drug through the skin. And the only thing you have to remember is to take the damn thing off, because you won't go to sleep if you don't. So the patch needs to be removed several hours before the anticipated bedtime. But the nice thing about the patch is you can make it last as long as you want. It isn't like the other pellet and pump systems. It doesn't have a built-in time decay in it. So if you happen to need to stay up a little later at night or need to be driving for a longer purpose into the evening hours, you just keep the patch on for longer hours. Maybe at some point you'll get the patch up here, I don't know, but we have it available in the US. It's also good for kids who can't swallow pills. Finally, last August was invented a brand new category of drug, and it is called a prodrug, and this is Vyvanse. Vyvanse is an amphetamine, but it's a non-abusable amphetamine, which eliminates one of the biggest social concerns we have about these drugs, was their abuse liability. And this drug cannot be abused. And you have to understand the structure of the drug to understand why, because what a little company over in Albany, New York did was to take amphetamine and lock it up with a chemical called lysine and bonded them together. And what does that do? It means the amphetamine cannot be activated. Now, when you swallow this tablet of Vyvanse, what's going to happen is there's an enzyme in your intestine, and especially in your bloodstream, that is going to strip off the lysine. And that leaves the amphetamine to be activated. So this is an amphetamine that can only be activated in the human gut and bloodstream, and nowhere else. Not in your nose, you can't snort it, you can't crush it, you can't inhale it like cocaine. It only activates in the gut and when it's absorbed through the intestinal lining into the blood. And then the amphetamine activates. So this eliminates one of the criticisms of amphetamine, that they have abuse liability. This one doesn't. The neat thing about this, only discovered after Shire bought the rights to this drug from the small biotech company, is that this lasts for 2 hours longer than the other delivery systems. This is about a 12-hour delivery system. There are some advantages to Vyvanse, and I expect you'll have this drug up here within a year or so, over Adderall. Adderall is the competing drug, and it's manufactured by the same company, Shire. But the advantage to Vyvanse is it's much softer in its onset and its offset during the day, whereas Adderall has a very rapid onset. People can feel it. In fact, some people get TMJ. They're clenching their teeth, and they have this tension that comes with the rapid onset of an amphetamine. So there may be some differences in side effect profiles with that drug. The next drug we have is the first drug, actually, that was approved in the US for adult ADHD, and that's Strattera. Strattera is not an amphetamine. It's not a stimulant. It's not classified as an abusable drug. It's a norepinephrine reuptake inhibitor. Now, the advantage to Strattera is it can be used in instances where stimulants may actually worsen people's comorbidities: anxiety, tics, OCD, insomnia, and other difficulties that stimulants may have the potential to worsen. Strattera does not worsen those problems. In fact, Strattera is a very effective anti-anxiety drug, as effective as any other drug we use for anxiety management. So one advantage it might have in the subset of patients who have anxiety is that it might manage both disorders. The disadvantage to Strattera is that it takes 3 to 4 weeks to titrate it up. You have to use it very gradually, because if you take it up too quickly, people get sedated and nauseous. And to avoid that happening, you have to adjust it very slowly. So that's a disadvantage, because if you need to treat the disorder yesterday, the stimulants are a much better option. But if you have time and you can be patient, Strattera is a very good drug. The second disadvantage is that it doesn't work quite as effectively in terms of the degree of improvement you get is a little bit less than what you would get with a stimulant. It still works for 3/4 of the people who take it, but the degree of change is not quite as much. The upside, however, is that we don't see as much emotional blunting as we saw with the stimulants. About 1 in 5 children, and even some adults, report to us that their emotions are quelled by the stimulants, that they seem to have a very blunted range of emotion or affect. And they don't like that feeling. And parents often refer to their children as sort of robot-like automatons. And Strattera doesn't seem to have that disadvantage. This hasn't been studied. These are just clinical reports. So there's another drug here that might be of advantageous for some types of ADHD with certain comorbidities. Now, lately, we've been studying the antihypertensive drugs, which are clonidine and guanfacine. And although they're often used to treat high blood pressure, they do have positive benefits for ADHD as well. And so Shire has now been able to develop and will market this August in the US an extended release form of guanfacine, and it will be called Intuniv. So we're going to have an antihypertensive drug on the approved list for treating children and adults with ADHD. And then, of course, we often argue that people should be started on the long-acting forms of these medicines right at the start to try to cover as much of the waking day as possible. And usually we find that even then they have to be supplemented with some of the immediate release drugs. So if you're taking Concerta or you're taking Adderall and you're only getting 8 or 9 hours out of that, but you've got a 16-hour day, we may recommend that an immediate release form of methylphenidate or amphetamine also be prescribed and used to fill that gap in time where you can't take a second form of the sustained release, not and get any sleep anyway. Ultimately, it's been our experience that unlike child ADHD, we're more likely to need to use several medications with adults with ADHD. And that is because the adults have high rates of comorbid disorders, anxiety and depression among them. These are not responsive to ADHD drugs. So medicating a person for ADHD doesn't touch their anxiety disorder, nor does it help their depression. Unless, of course, you're using another drug to manage those, or in the case of Strattera, which does have some anti-anxiety properties. Now, there are other treatments that have been developed in the last 2 years in the States that are psychosocial. We now know that contrary to what we learned about childhood ADHD, adults with ADHD do respond to cognitive behavioral therapy. And so now there are 2 treatment manuals on the market based on research that's been done at Harvard Med School and at the University of Pennsylvania by Safran and Ramsey, respectively. And you can find these at the addwarehouse.com or just by searching Amazon, and you will find that there are treatment manuals for working with adults. But you need to understand that in all of this research, the cognitive behavioral training around executive functioning, because that's what they target, is executive functioning, the working memory and the other deficits I spoke about this morning, that these are supplements to medication, that the patient needs to be on medication to benefit from the cognitive behavioral training. That if they're not on medication, they're highly unlikely to be responsive, much less to show up for their appointment. One of the best things that we have found adults can do in addition to going through these cognitive training programs, getting on medication, is to find other people in life that you can use to make yourself accountable to each day for the work or the goals or the other things that you have promise that you are going to get done or that you're trying to accomplish that day. Whether it's in the workplace, whether it's in the college environment, whether it's in your marriage or elsewhere, you are much more likely to adhere and complete a task if you commit to doing it in front of others and make yourself accountable to them for meeting with them several times a day in order to see how you're doing in meeting those goals. The coaching network was in fact developed to fill this gap, where if you don't have other people, significant others in your life, you can go to the coachingnetwork.com or other resources and link up with the people who are willing to do this kind of accountability, for a fee, of course, but nevertheless, they are available. And Heidi, I don't know if you're in the room and whether CADDAC or CADDRA link up with these coaching systems or not, but certainly I'm sure a search of the web would find them here in Canada quite easily. The next thing we need to do with adults with ADHD is to help them down-regulate their reliance on legal and illegal substances. Whether this is putting them through smoking cessation programs, which, by the way, they are not likely to respond to if they are not medicated for their ADHD. We have now found that you've got to treat the self-regulation disorder before they can benefit from these detox programs. So that is what we try to do, whether it's with a stimulant, whether it's with atomoxetine, but they need to be on medication before you try to detox off of these other drugs. Obviously, getting assistance with time management and organization. If you live near a major metropolitan area, which clearly the Toronto area is, you will find in the yellow pages people who specialize in professional organization and time management. And we have linked our adult clinics up with these individuals where we teach them about adult ADHD, and they accept our referrals of people who want to go and have an expert come out and reorganize your office, your job, your work life, your house, whatever it may take in order for the flow of work to be better suited to the ADHD part of your life. These are people who, with appropriate training, can be quite useful in advising you on how to make your life better organized and your time management more successful. Now, with young people, we have found it necessary to reevaluate them for ADHD-friendly occupations, because some occupations are not real friendly to adult ADHD. Others may have started out being friendly, and then you get promoted. And the promotion brings with it a greater responsibility, and with that, we see a greater impairment. An example was a young man that we were working with a computer company in Massachusetts, who was Salesman of the Year for New England for this computer company. Loved it, out all the time, driving around New England, meeting with customers, making sales. Had a great organized OCD secretary to follow up on the paperwork. Just did wonderfully, making a ton of money on commission. So good they promoted him. He became district sales manager. Do you know what a district sales manager does? He sits in an office all day long and tracks the sales of the agents in the field. And he could not stay in that office. So they're ready to fire him. So we said, you can either be medicated for your ADHD, and maybe you might be able to make it in this job, or you might just ask for a transfer back to the field. Better you have a job and be successful than have no job at all. And so sometimes we not only reassess the job, we ask you to maybe take a shift in the nature of the job to make it a little bit more ADHD friendly for that individual. Obviously, in the US, we have laws now, the Americans with Disabilities Act, that require that your employer make reasonable accommodations for your disorder. You cannot be fired if there has been no reasonable accommodation made. If there has been one and you're still not doing the job, you can be fired. But the word is reasonable. Right? Now, the other side of that coin is you have to tell your employer that you have the disorder and prove it with documentation. A lot of times that goes very well. Many employers are sensitive and compassionate and wish not to be sued. Others, however, will take this the wrong way, and they don't want you here anymore. And so they will go through any hoops they need to document your failures and to make superficial adjustments that they declare as reasonable. But their ultimate goal is to fire you. So we do not tell adults with ADHD to go running down the hallways of all of their employers' places, screaming about their ADHD and how wonderful it is, because in some instances that comes back to bite you. It requires some careful forethought, discussion with a professional, understanding the nature of that workplace, maybe doing a little research about previous accommodations that that employer has or has not made before one actually discloses the ADHD. Now, for our adults with ADHD who are living with other people, cohabiting, or married, we often find that some short-term marriage counseling or relationship counseling is in order. Gina Paris spoke about this, I believe, here yesterday. If she didn't, she has one of the best books published just a month ago on this aspect of adult ADHD. It's called Is It You, Me, or Adult ADHD? And it is a book for spouses, partners, others who must live with the adult with ADHD, and how to readjust your relationship and your home life to accommodate the adult with ADHD. It's an extraordinarily well-written book. I highly recommend it to you.
I'm sorry.
Yes.
Can I interrupt? Gina Pierre is presenting this afternoon.
Oh.
We just found out this morning, last night, she won 4 book awards for that book.
Thank you, Heidi. Hey, how great is that? Okay. Wonderful. Well, see, yeah, she's here, right on site. But some counseling, in addition to just reading a self-help book, is usually necessary, partly for information, partly to teach the partner or spouse about ADHD, and also to handle any other issues, because some of the issues are not ADHD related. I mean, let's face it, some of us can be jerks in our marriages, and being a jerk has nothing to do with being ADHD, and we're going to have to deal with our jerkiness with our partners. So that needs to be dealt with as well, along with the other comorbidities. Now, time doesn't permit me to go through each and every recommendation. I wanted you to have these in your handout. So the next 3 or 4 slides are simply a list of common sense adjustments, changes to the workplace, changes to the school, changes to the relationship, or to your home life that you may find helpful in adapting to the executive deficits that we have spoken about. So I just wanted you to take these with you because we're just not going to go over these, and nor is there a need to, because these are quite, I think, self-explanatory.